Welcome to the deep dive. Today we're diving into something really important: cholesterol. Specifically, what those numbers on your blood test actually mean.
Right.
We've been looking at some great materials, especially from Blood Test UK, which really breaks down the services in places like Reading in the UK.
Yeah, and our mission today is pretty simple. We want to figure out why this one test is so crucial for your heart health and, just how easy it is to get it done.
Absolutely. The focus is really on the benefits, which Blood Test UK highlights.
Exactly.
Okay, so let's unpack this. The test is looking for fats in your blood, but it's a bit more complicated than that.
It is. It really comes down to two main types, and people call them good and bad cholesterol.
All right, LDL and HDL. So what's the deal with LDL, the bad one?
Well, think of LDL as being kind of sticky. If you have too much of it, and we're talking levels over, say, 3 millimole, it can start to build up on the walls of your arteries.
Okay, and that's obviously not good.
Not at all. Then you have HDL, the good stuff. This is like the cleanup crew. Its job is to grab that excess cholesterol and take it back to the liver.
So you want more of that.
You do. If your HDL is too low, maybe under 1 millimole, that can be a worry too. And then there's triglycerides.
Yeah, what are those?
They're another type of fat, basically your body's stored energy. High levels can also be a risk factor.
So why do people even get tested in the first place? Is it just routine?
Often it's because of, a family history of heart problems or maybe certain lifestyle habits. Sometimes it's because of symptoms like chest pain. It's all about catching things early.
That seems to be the main benefit, right? What Blood Test UK really emphasizes is that this is an early warning system.
It's a huge benefit. It helps you spot potential issues before they become, big problems like a heart attack or a stroke.
And knowing your numbers is powerful. It lets you take control.
That's the fascinating part. It empowers you. Once you know your numbers, you can make real informed changes to your lifestyle.
Like what specifically?
Simple things, really. Eating more fresh food, maybe trying something like a Mediterranean diet, moving your body more. These aren't just vague suggestions. They can actually lower that bad LDL and raise the good HDL.
Okay, so let's get practical. For anyone listening in the UK, how do you book one of these tests?
It's actually really straightforward. The info from Blood Test UK shows that for places like Reading, you just need your NHS number and some ID, like a passport.
And you can book online or call your GP.
Yep, it's designed to be simple. But there is one crucial thing to remember before you go.
What's that?
You usually need to fast. That means no food for about 9 to 12 hours beforehand.
Why is that so important?
It's to make sure the results are accurate, especially for your triglycerides. It gives a true baseline of what's going on in your body.
Right. And how often should you be checking this?
Good question. The general advice is for adults over 40 to get checked at least every 5 years. But if you have other risks like high blood pressure or diabetes, you'll probably need to do it more often.
So when we boil it all down, what does this all mean for you listening?
It means getting tested is a simple, quick step that can lead to really big, positive health changes.
Timely testing, as the materials from Blood Test UK show, just really improves your health outcomes in the long run.
Absolutely. The final takeaway is this: regular cholesterol testing helps you manage your health. You're not just a passenger, you're in the driver's seat.
I like that.
And here's something to think about. If simple changes in diet and exercise can have such a profound effect on these numbers, what other tiny health changes could you make that might lead to massive long-term benefits?
A great question to end on. Thank you for joining this deep dive.